gut-brain axis. So yeah, welcome to once again. So topic is here the gut-brain axis, and only I'm focusing here the psychiatry related in certain areas in psychiatry where we have the abundance of the evidences are recruiting and focusing on the mental health aspects, and certain little bit I am focusing because I am expertise in the addiction psychiatry, specialized in psychiatry. So more focusing on the rest of the more focusing on the addictive disorders too. So with this introduction, I will go into the topic. Uh, First of all, yeah, Raju, can I move slides? Yeah. So this is the disclaimer showing that here all the images and conflict of interest here. Yes, please, Raju, please follow. Next, go for it. And this is my outline presentation. Here I would like to tell about the structure. What is the structure of this axis and its mechanism, and how it's linked with this gut-brain microbiota with psychiatric illnesses and some psychobiotic relevances. And along with that, specifically focus on the addictive disorders. And what is the limitations up to so far this knowledge we gain from this gut-brain axis related interventions, and what are the future directions we require. Yeah, please. Next slide. Raju, next slide. Yeah, next slide, please. Yeah, before starting the topic, I need to some sensing examples. Why this axis is having of existence and importance. When you see that gut to brain, whenever we see something tasty, what the brain signals to gut, it prepares your gut to for certain food. So means it's a gut is responding according to your brain signals. And same way, when you feel anxious and stress, we might feel some of the abdominal distress and butterflies also. So means gut is also responding to according to your instant emotions. Whereas the brain to gut also means a top down. Here, whenever you eat something which making us to sick also, we instantly avoid certain types of the food, and even not only food, we avoid certain places in condition to that food also. So means here gut related sensations also influence the brain behavior also. So with this sensing examples, I wanted to started to tell about that what is the structure of this gut brain axis. Next one, Raju. So here this picture is showing that very popular picture. Is the having of brain and gut having of innervations bidirectionally having of some networks. It's a various modes of the networks. That was a sensory modalities, and as well as certain immunological, endocrinological, and where the modulators also, and brain metabolites and byproducts all are having of influencing bidirectional network, especially from the brain to gut. It was the parasympathetic nervous system by the vagus nerve, which has innervated, and what afferent information from the gut environment reaches to the brain, and brain having of stimulation by the various other afferent systems also, like inflammatory, metabolite, and gut produced neurotransmitters, which are having of implicated on the brain. And brain also bidirectionally it's like having of control over the intestine functions in terms of the HPA axis, cytokines. So it has the various neuroanatomical pathways and mechanisms are there to influence and to establish bidirectional networks. So by the way, that was the communication is established. Overall, these mechanisms are showing that these are the interconnectedness of the communication between the brain, gut, and microbiota. These three systems having of communicated through the enteric nervous system and as well as CNS and peripheral system. Next slide, please. So one system is called direct activation neural pathway. Another system is called immune activation. Another thing is the microbiomes. Next. Here, this slide is showing some funny examples about that. So here the microorganisms are saying that we are living with the human cells in a living symbiotic manner. Means human life doesn't possible to exist without microbiomes. Microbiomes having of equal number, even in the recent evidences in the recent 2016 onwards, evidence are saying that it's not a 1:1 ratio of the human cells in microbiomes. It is a 10 times more than the human cells which are their microbiomes, various species and strata is available. So means whatever the you are liking the food, you are liking the whatever the certain stimuluses, it's not by you. Actually, microorganisms which are there in the certain quantity in the certain specific regions of the intestine, they're loving. By the way, you are getting the feeling of the. It's a feeling of good. It's a feeling of bad type of the tastes. So means humans nutrition microbes are what they are having of in role about that to making the digestion of the food, detoxification of the toxicants, means not to make the person to infect also. That was decided by the microbiomes which are there in the colon. And very importantly, innate and immunity and as well as acquired immunity also. Majority of the innate immunity is decided by the having of flora in the flora in the intestine. And last but not least is the functioning of the brain also. It's a decided by the microbes. So we have to respect the microbiomes. Next one, slide. So whenever you disrupt this gut microbiota, your physical health and as well as not only physical health, mental health also affected. Next. So, okay, we know the importance. More than that, we know something else, some to know the more and more. Yes, there is this acquiring of microbiota is not happening by the day or the day related the developments. It's a developing from the mother's womb onwards. Even the mode of delivery also decide which type of the microbiota flora will be exist in the gut, and that decides the later than the development of the brain and brain maturation and all aspects also having of deciding by some part by the microorganisms which are present in the colon. So this flora will be started from the lower third of the esophagus to up to the last part of the rectum. So means they are the deciding the more and more implications with the CNS communications and as well as their developments. So it's a mostly these are the host specific one. So throughout the individual lifetime, the microbiota also evolved with the various exogenous endogenous modifications. So it's a nearly 500 to 1,000 species are there in the human intestines. These are the dominant we are finding in the human population. When compared to clinical population, preclinical population, they are the having of various other microbiota, but these are the two predominant ones. Nearly 10:1 ratio is existing, but predominantly the colon. That's a 70% of the most colons are the having of in the microbiota is there in the colon. So majorly these functions is showing in terms of the production of the neurotransmitters, means 90% of the serotonin production will be decided by the intestine production only, and as well as other catecholamines and GABA and short chain fatty acids is a very importantly maintain the functions for the brain myelinations also, and it regulates the tryptophan levels too also. Next slide, please. Yes, important study, the landmark study. We came the most of the knowledge from the human microbiome project in 2008, which is an NIH sponsored one. It's mainly with the working with the to achieving the what the association for the both of the healthy and as well as diseased humans with in relation to microorganisms. It's having of certain valid information we gain from that. Yes, next slide. So I am covering these topics with these things. So in that predominant just now we discovered that these two brain and second brain, what we call the entry nervous system of the gut and microbiota in relation to that, we call it a second brain. It having of innervation with the bottom up manner and as well as top down manner, like a same how the way we are discussing the psychobiology in the brain, like a cortex to subcortical areas and top down bottom up controls. The same manner here also bottom-up manner and as well as top-down manner. We are the having of brain and second brain innervated with the various discussion with the neuroanatomical pathway, immunological pathway, neuroendocrinal influence with the young HPA developments, and neurotransmitters and neuropeptides. Yeah, next slide. Please continue, Raju. So here the gut microbiota brain is what are the things are influencing certain neurotransmitter like a GABA and BDNF and intestinal barrier, how tightly the junction of the interstitial epithelium is there, and there is any modulation of the enteric sensory afferents and bacterial metabolites. These are all the regulating the gut brain to gut microbiota to the brain. Whereas the brain to gut microbiota also influence, brain also influence individuals microbiota in terms of the quality of the mucus and biofilm production. That's the way we have to getting of the stool consistency and the motility of the intestine, all of the deciding. Even permeability of the intestines and immune functions also influence. Yes, please. Yeah, neuronal pathway. Just now we discussed that it is a majorly separated by the through from the brain to gut is a vagus nerve. It's a having of direct connection between that from the mucosa of the gut to the brain. And the another one, the pain related sensations also directly having of in control the dorsal root ganglion, which afferent relay pain and other supraphysiological stimuluses also, which influence the from the gut to the brain. Yes, please. So here, certain bacteria, especially predominantly Lactobacillus rhamnosus, having a increase the firing rate in the especially mesenteric nerve bundle, which shows that decrease stress-induced corticosteroid and anxiety levels, and even whenever the vagotomy related the interventions showing that this probiotic influences will be the cut down. So means this bacteria having of influencing the motility related functions and HP related axis related functions also. Next thing, the immune related the activation. So whenever the immune related the changes, the having of in connection with the bacteria, which causing them to the altered of intestinal permeability, leads to more and more endotoxins, which is releasing from the infective bacteria and as well as pathogenic bacteria, which causing to the increased circulations in the from the through permeability increasing nature. So it is transmitting into the blood flow, and it causes to the more neurobehavioral dysfunctions also. So if you say it's a low inflammatory status to the high inflammatory status, there is a various clinical and preclinical studies are showing that there are certain things like a germ-free mice where we are usually doing that research studies on this in this scenario, and antibiotic treatments, probiotic treatments, and eventually the gut inflammations and the experimental manipulations leads to the gain more and more knowledge related to the immune activations. Next slide. So overall, this information, inflammatory markers, which are the pro-inflammatory cytokines like interleukin-1, interleukin-8, so TNF alpha, all these are the inflammatory markers which is showing that immunological changes in the brain and as well as gut also. Then coming to the circulatory neurotransmitters also. So serotonin production is decided by the bifidobacteria, streptococcus, and certain species of the Escherichia, where the GABA is also majorly released by the microbiota like a lactobacillus and bifidobacteria families, and dopamine noradrenaline related the neurotransmitters are released by the bacillus families. Acetylcholine is released by the lactobacillus family. So means certain important neurotransmitters also released by the bacteria. Yeah, next slide. Next, coming to the circulatory, certain other mediators. What are there? Short chain fatty acids like butyrate and propionate and acetate. So these are these kind of the G protein coupled receptors have bind on this receptor, eventually leading to the downstream effects which causing the neurodegenerative. It has an implication, neurodegenerative implications also in especially Parkinson and Huntington disease. Where the bile acids, which are the new gut hormones, which showing that is also having of influencing on the certain neurodegeneratives are like Alzheimer's and Parkinson's also. Next slide. Let's come to the psychiatric illnesses, how it's influencing. I'm touching with the only certain important area where we have the more evidence on this up to the 2020. So here the inflammatory bowel syndrome, that's a irritable bowel syndrome, which are the diarrhea. Mostly diarrhea variety is a having of highly gut-brain axis related the microbiota manipulations we can implicate. So how do we gain the evidence of that? Means 20% of the IBS people, they are showing that culture positive. Means the bacteria is influencing, that's a pathogenic bacteria, bad bacteria, is altering the functions of the intestine. And there are the studies also showing that sampling methods are showing more than 1/3 having of evidence that overgrowth is there in the intestines. And diarrhea predominant having of showing the 60% of overgrowth also. Next, coming to the depression, Raju. Yeah, various studies are showing that the diversity of the fecal bacterial flora is showing that having of more influencing in the brain related the cognition, motivation, and behavioral aspects. It's giving that more and more specific genera also differ in the depression patient when compared to control. So this also depression having of more and more favorable evidence with the bifidobacteria and as well as lactobacillus bacteria, especially bacteriides family, which are there, which are the having of lower side in the these sampling methods of the depression populations. Next. So animal models also showing that altered tryptophan metabolism is also. Next slide, please. Coming to the autism, and not in psychiatric conditions, autism having of more evidence is recruiting in the with the gut microbiota manipulations, and followed by the ADHD conditions also, and even followed by the dyslexia, other social anxiety disorders type of thing. In that, if I discuss with the autism related things, majority of the autism populations, especially they are complaining of more and more, around the 60 to 70% they are having of complaint about that gut motility issues also. So abdominal pain, diarrhea, constipation, mostly showing that here. So Clostridium related lactobacillus having of more and more implicated with the correlated with the behavioral symptoms, decreasing of the bacteriides and vermiculus ratio, which is there. That ratio decrease, it also having of more autistic related the traits are there. So bacteriides fragilis normalize the aberrant behavior also. So manipulation of the bacteriides certain species or microbiota certain species like a bacteriides, we can able to normalize the aberrant behavior, especially social reciprocity behaviors. Actually, next. So it's not only infant related changes. Even this slide is showing that very recent 2020 article is showing that even mother womb itself also abnormal gut microbiota can influence through immune system. Brain development is getting into the influence in the infant. So means either it's a inflammatory markers or antibodies for their pathogenic or as well as intestinal epithelium related the things or bacterial fragmented bacterial cell membranes which are there that was causing the more antigenic response, which eventually lead into the antibody response to the cell membranes, which cross into the blood-brain barriers of the infant, which influence in the neurodevelopment and especially microglia inflammatory changes, which having of facilitated or augmented inflammatory changes are there. So that causing them to the more and more it causes the more and more neurodevelopmental aberrations, especially the neurogenesis and as well as especially pruning aspects. The pruning defects was very commonly we seen in the while the brain development when we have the abnormal gut microflora aberrations are there. So it is eventually lead into the neurodevelopmental repercussions, which are mostly coming to the social reciprocity and later then by the language related the things, which are the artistic traits we have the getting into the express in the child. Next slide. Coming to the anxiety features also having of especially certain when we work on the psychosomatic illness aspects or concentration loss and psychiatric aspects, where we having a functional disorder when we get into consultations. First and foremost thing, they are the having of functional GA related symptoms was getting to the notice when the having of either diarrhea or having of some sort of the in gastroenteritis related the infections. Later then, these are the getting into the anxiety related the behaviors getting into the manifested, which are the presenting in persistent form. So those who are exposed more on the bifidobacterium longi, they're having of more normalized the anxiety-like behaviors also. Next slide. Then coming to the neurocognitive aspects also. Raju? Yeah. Hello, Raju? Yeah. Anxiety-related the symptoms also having of implicated. So here the mostly intestinal infection is showing that more odds ratio, 1.34 of odds ratio in the anxiety disorder will be continued in the subsequent times also, showing only that. Next. So yeah, cognitive aspects also it influence that majorly Alzheimer's disease and as well as Parkinson's disease, multi-infarct dementia. So this is all showing that the diversity of the gut flora will be the becoming the lowest. So that is the influence on the cognitive activity itself and eventually metabolic activity also, and the impairs in the recent memory related changes also. Whenever the manipulations also showing the clinical studies are coming that there was the improving of the short-term memory and as well as working memory aspects. Next slide. Psychosis related changes also noticed in the especially the protozoan like Toxoplasma gondii, which are the having of strongly implicated in the schizophrenic illness type of things also. Yeah, next. So then coming to the psychobiotic concept, what it there? Yes, continue. This psychobiotic is nothing but probiotics and as well as prebiotics, which we have the influence on the mental health functions also. So family of live bacteria, which are the ingested in a certain quantities, which influence the positive mental health, those called the psychobiotics, and it covers not only with the probiotics, even the prebiotics also, which are the soluble fibers, which stimulates to causing the more growth of the good bacteria in the intestine. So the like what we call that galacto oligosaccharides or fructose oligosaccharides, they're also showing that here. Then there are the certain evidence are coming that psychobiotics, this was showing that the daily subchronic administration of this probiotic formula, which alleviate the psychological distress in the experimental manner, case control manner, in terms of the anxiety reduction, psychological distress reduction in the volunteers, and even the chronic fatigue symptoms also having of showing that there is a significant decrease in the anxiety related symptoms when who are taking the probiotics when compared to controls. Next. Raju, we are running the short piece yeah. Next, coming to these certain psychobiotics having of significant findings up to so far with the evidence we shared, say reduced stress responses with the certain species like a bifidobacterium langus and enhanced cognitive activities. Where the prebiotic type of the fiber related things like a fructo oligosaccharides and galacto oligosaccharides, which is the in a case control manner, if you study with that, where we have the reduced waking cortisol related the responses also, means they are increasing the showing the stimulus, attention to the positive stimulus also. Next slide. And another more certain species, Lactobacillus cassis, they are tested in the healthy medical students in the 8-week prior to the examination stress. So their academic stress they reported in a reduced manner, and that was correlated with the salivary cortisol also. These are the evidence are showing that it influences on the stress and as well as negative mood also. Next slide. So overall, this evidence is coming up with that yes, psychobiotics in terms of the pro and prebiotics can change the brain activity also. So certain the regimens we have the decides the what level of the response we can get. Then specifically focus on the addictive disorders. I'm not need not to go in the detail about that. I'm just presenting certain important points in the slides. So here the slide picture is showing that how the gut brain microbiota having of influence or association with the alcohol use. So generally alcohol use population, they're not only decide by the only alcohol use, they decide by they are the genetical backup nature and what are the pattern of diet they consume, whether it's a high fat diet, high sugar diet, alcohol level or quantity of the consumption, and they're taking the probiotic or not like that. And biological stress also, all they are the lead into the two important changes, whether the microbiota alteration and second thing is the increasing of intestinal permeability that lead into the more and more leaky gut is happening in the intestine. So that causes them to the more endotoxins it released into the enterohepatic system that cause into the reaches to the brain and eventually impact on the cognitive aspects of the brain, and as well as not only for that, that enterohepatic system getting into the more accumulating of more endotoxins like LPS, the lipopolysaccharides, that causes the stimulating the phagocyte stimulation, eventually fibrotic related changes or alcoholic associated liver disease related the stage related progressions, eventually causing to the fibrotic of the cirrhosis or fibrosis of the liver, and sometimes it may turn into the progression into the cancers too. Next slide, please. So, what are the mechanistic things are there in the this microbiota, gut brain microbiota with alcohol use disorder? Here, toll like receptors of 4 of variety is the key receptors in the development of the alcohol liver disease for the phagocyte stimulation in the liver hepatocytes. So that causing to the these specified certain specific bacteria like lactobacillus bifidobacterium, so which causes them to the more and more alteration of the barrier of this gut barrier that causes them to the more leaky gut liver, and that eventually stimulates the phagocytes also. And certain absence of gut microbiota, this association with the modulation of the hepatic intestinal expression of the metabolizing enzymes of the alcohol like ADH, catalase, cytochrome P450, this is also modified. So overall, what I'm telling is gut microbiota is increasing the evidence in aspects of the mediated to the brain functions also and modulate the ALD pathway. Next slide, please. Yeah. So what the effect? There is a certain next subsequent 4 or 5 slides are showing that more how the alcohol affect on the gut microbiota. Here, overall, just now I have told that there the study evidences are coming from the 2012 onwards, having of showing that case control manner. They are tested in the first while the time of their admission and followed by the 3 weeks of the abstinence, how their microbiota is changed, whether the whatever the existence of the microbiota at the time of the admission, they are having of more intestinal permeability, more LPS levels in the blood, and cytokine, pro-inflammatory cytokines are there in the blood. Eventually, 3 weeks of the abstinence, that's showing that the recovery of the cytokines is happening. Means the abstinence is changing their gut microflora. It's showing that not only eventually changes, it's reflecting with the how fast is the recovery, the depression and anxiety and craving factors. Those are also showing the improving, means elevating. So overall, what I'm telling is inflammation and intestinal permeability, it having of association with the level of the means it's showing the level of the inflammation and intestinal permeability that aids, that supports your alcohol dependence diagnosis itself. And alcohol dependence related the behavior changes like a craving, like a depression and anxiety behavior changes. These are also having of correlating with this microflora related the events. Next slide. Raju, please. Here the some subset of the population, like a alcohol dependent population, they are showing that poor high depression, high anxiety, high craving. They are the having of demonstrated more intestinal permeabilities, more alteration of their gut microbiota when compared to after 3 weeks of the after 4 weeks of the abstinent period of the time. So this is also another added evidences here. Yes, these are the involvement of the gut-brain axis in the alcohol dependence development, and as well as inflammation in the further, which is correlating for the behavioral changes in the alcohol dependence also. Next slide. So here, this microbiota dysbiosis, which causing the alteration, which make them to the more and more permeability of the intestinal epithelium. So reaches to the more lipopolysaccharides, peptidoglycans from the gut lumen to the interstitial related the tissues, reaches to the enterohepatic circulation and systemic circulation. Eventually, it reaches the brain, which generates the depression and anxiety like type of the behavioral correlates, and that causing them to the more and more craving that result into the over consumption of the again the alcohol. So that again the causes the dysbiosis in the gut. So this is the like a a vicious cycle, which is impacted by the alcohol. Yes, please. Again, the same story here also repeated with the around the 20 population of the alcohol dependent population. They studied the taxonomic analysis of the various abundance of the predominant bacteria, which is there, how the changes. Here they're showing that Faecalibacterium and Artemis gira is the decreasing in the alcohol dependent population. So these are the important changes which are noticed that, and there are the presence of the opportunity pathogens rarely detected in the metazones of healthy individuals from the different countries. Means the alcohol dependence diagnosis having a specific alteration of the microbiota related changes. Yes, please. Next. And another more big sample, 72 patients with the alcohol dependence and 27 patients with the alcohol liver disease and 60 control they are tested. And here also coming with the important findings that certain species like a Clostridialis, which is the actually this species is supposed to produce the butyrate rated the neuro metabolites, which is the having of protection of the brain cognitive functions, which is the inversely correlated, meaning down, the chances of the person getting to the cirrhosis will be the more and more. So cirrhotic populations having of more correlated with the reduction of the Clostridialis order, and enterobacteria, which are there, which is the more hallmark for the cirrhotic related the changes. Means even the alcohol liver disease spectrum and the dependent population also varied their flora. Enterobacteria is a more having of showing the more opportunistic pathogens in the cirrhotic population, whereas the Clostridiasis are they are the having of inversely related with the alcohol dependence related the condition, where the cirrhosis related things is the bacteriitis is the species is the becoming the inversely correlated. So dependence, cirrhosis, and having of their respectively having of their flora related the structure. Means it's a look like a biomarker also having of potential in identifying of alcohol dependence syndrome, and alcohol associated liver disease also can be able to the make them to the as a study with like a biomarker type of things. Next slide, please. So apart from that, not only flora, this flora also getting into the influenced by the genetic and environmental factors, so like nutrition, genetics, lifestyle. So we should not be forget some macro factors also here influence along with the alcohol consumption. These are the also influence the flora related the changes. So these are the confounders here. Next slide. So overall, with this evidence, can these probiotics can be prescribed in the alcohol use population? Is there rational? Is there? Yes. Decreasing of their certain beneficial bacteria like lactobacillus and bifidobacteria, they are showing that in alcohol dependent population are there. So their experimental models of the alcohol liver disease also showing that more modulation can be expected of this useful bacteria, which is coming from the preclinical study of the lactobacillus and bifidobacteria, which reduces the gut leakiness, endotoxemia, inflammation, and improve the liver function also. That was coming with the it's a regimen like a 5-day supplementation regimen or 4-week supplementation regimen. The overall, the benefits are definitely recruiting with the extended period. There's a 4-week administration having showing that alcohol liver disease related the molecular changes are getting into the reversing also happening. Next slide. Yeah, next slide, Raju. Faecalibacterium and bifidobacterium. These two things are the drastically decreasing the alcoholic using populations. So, which they are actually exhibiting anti-inflammatory properties. So, which are the prebiotics, which is what's called galacto-oligosaccharides and ingredient type fructans, which showing that increasing of their useful bacteria, Faecalibacteria and bifidobacteria, which are the human bacteria, which we are the correlating with this alcohol use population. So overall, the regulation of the numerous behaviors also can be seen with this from the preclinical studies, especially hippocampal region related the BDNF levels and glutamate receptor expressions also having of changes association is noted with the prebiotic exposure in the rats. Next slide. Raju, next slide. Yeah. Again, apart from that, other substances also we are noting that in cocaine substance users also, There are the specific alteration in the host microbiome, especially the cocaine related the reward sensitivity and repeated sensitization process also getting to the morely manipulated with the gut microbiomes. It is having of the influence when compared to healthy volunteers are noted. So this alteration of the gut microbiome is also affecting the behavioral responses like a craving and as well as reward sensitivity related aspects also showing in the cocaine populations. Next slide. Then subsequently the biomarker potentials also will have also tested with the certain specific genera also change in the HIV with comorbid cocaine use population uh, when compared to HIV population. So cocaine users and along with HIV population having of differential microbiota flora is there, and their microbial translocation interventions also having of the showing the corresponding changes also noted there. Next slide. So biomarker potential also having a valid question. So overall, this 30 minutes of our discussion, what is saying that the literature is still having of certain limitations also there. Majority of the studies are coming from the manipulations are coming based on the animal-based studies. Though the human trials are there, but mostly they are the require the more large scale of the randomized controlled trials are required. And majority of the up to so far the studies are having of limitation with the equivocal results are showing that, and heterogeneous designs are there make that, and doesn't consider in the huge macro influences also has a confounders that was not adequately addressed. These are the limitations are noted in the literature. For informing sake of our colleague psychiatrist, I would like to say still it's like a food supplementation related things which are having of some molecular or related the mechanisms are implicated in the biologically for the various psychiatric illnesses and the substance use populations. They're having of their influences are there for the this microbiota related things. Whether they effectively we have to using of these prebiotics and probiotics of their prescription with the selection of the subpopulation is important, and selection of the probiotic composition is important. What is the dose is also important. So we have to more targeted based in prescriptions are required here. Next slide, please. Yes, with these things, I would like to the still having the future direction here. So mental health related studies, we require the more robust studies for repair for the human populations, especially the affected patients with their efficacy we have to test it. And systematic animal and human studies are required for the identifying of the specific microbes, and etiopathogenic mechanisms also need to more and more we have to need added evidences with the doing of the interventional selective vagotomies, bile acid receptors, toll-like receptors. We have to correlate with the clinical response along with the biological correlating of these changes of the toll-like receptors efficacies, bile acid related the receptors expressions. So these are the added the role to understand more etiopathogenic manner. Next slide, please. Yeah, important thing is the sampling which we are the executed, the site of the sampling and the what are the mucosal microbes along with the length of the gut. See, it's a gut related the specific microbes is presenting. So where we are the correlating here, whether it's a proximal or distal or luminal or mucosal axis, where we have to test it. These are the things that need to more give the in accurate manner. And whatever the microbiome based methods we are the having of therapeutic response, we have to identify most beneficial therapy, which is the whether it's a transplant of the therapy or like a mucosal fecal transplant or probiotic or prebiotic prescriptions, or it's a dose response relationship we are established, and we have to consider how much the duration we have to expected the benefits also there, because the majority of the studies we are coming that a short term benefits are there more. So how we have to sustain it, and adverse effects also we have to monitor here. And but not least the RCT of the studies are required for the especially therapies for the specific conditions also needed much more. Yeah, next slide, please. With this, I would like to conclusion here. So overall, human gut brain microbiota has a fundamental role in the host physiology and pathology, including the mental health also. So here, additional investigation is needed to determine what is the causative versus epiphenological aspects. For example, if I say it's a mental health and as well as substance use aspects, still yet our evidence is there preliminary in nature, and we need to manipulation of this microbiome gut brain axis may represent novel approaches for the treatment of mental health disorders and as well as substance use disorders. Thank you, one and all. So overall, our life will be mingling and existing along with the symbiotically the microorganisms which are there in our body. So we have to maintain it and take care of our intestines, providing of normal gut flora, which is essential for the normal functions and mental health functions also. Thank you once again, Kepler Pharma. And last but not least, I would like to acknowledge that this probiotic prescriptions, which are the encouraging from the mental health field also, very much essential in terms of the evolving of field of this research and having up to so far of the evidence so far, though it's a preliminary, but clinical efficacy aspects and biological information what we are gaining here, this manipulation of this axis related the things essentially important for the disease progression, not only recognition, progression also important. Psychosomatic illness like irritable bowel syndrome, the already evidence established one also there.
Yeah.
Thank you, Raju.
Doctor. Yeah, thank you, doctor, for the wonderful explanation on the gut-brain axis. Mainly touched the new dimension in the gut-brain axis and an alcohol. Supporting that, many references also you clearly explained. I hope this webinar will help all the doctors to in the day-to-day practice also to treat the patient. And audience, if you have any doubts, I request you please unmute and ask, or in the chat box also you can ask the doctor. If any doubts are there related on the gut-brain axis, any other topic also. Yes.
Yeah.
Sir, okay, sir. I feel they already understood after your presentation. If any doubts are there, sir, I will get back to you. If anybody is asking, I will. I will ask and I will clarify the doubts. Yeah.
Once anybody questions may come, please let me know. We can.
Yes, yes. I will pass the question and get the answer, sir.
Thank you, one and all, Kepler. This is a good initiative from our side. I think so. This webinar, this type of the things, still it's a many people now. It's a post-corona. We are coming out from the webinar system also, but it's a very useful to connect. We start with this type of the academic activities, and I'm thankful for your initiative.
Thank you very much, sir. Yeah, without hesitating, also actually shown interested and you come forward, and from on behalf of Kepler Healthcare, and we are thankful to you, sir. Further, also we will do these webinars and even for the CMEs also on the new topics of gut-brain axis and all related psychiatry topics also we will do, sir.
Yeah.
And thank you one and all for the participating in this webinar. Thank you very much, Jyoti sir.
Okay, Raju, can I leave?
Yeah. Yes, sir. Thank you, sir.
Thank you. Thank you.
Thank you so much, Naveen sir, for a wonderful talk. Bye.
Thank you, sir. Thank you, sir. I hope the number is 40 touch. It's a very good number. I expect it's the number.
Yes, sir, 40 to 43 test touch.
Yeah, it's a very good number. Just to have seen that. It's wonderful. We reached our purpose.
Yes. Right, doctor.
Thank you so much, sir, for your efforts in enlightening us. Thank you.
Thank you.
Thank you all.
Bye. Bye.